In the modern times, we have so many options of IOLs to choose from, be it monofocal, multifocal, trifocal, toric IOLs, extended depth of focus lenses. So, whenever we advise cataract surgery, there is a big confusion in patients' mind as to what lens is suitable for. This video tries to address this issue. Now, this is a decision tree for deciding about what lens is suitable for one side. Let us try to dissect this in small bits and try to make sense out of it. So, first thing that one has to do when one decides about cataract surgery is to understand your own needs. We call it as individual needs. And second is to understand the suitability of the eye for a particular IOL. And that is usually decided by your operating surgeon. In assessing the individual needs, the question that one should ask to oneself is the need for glasses after the cataract surgery. So if there are two broad categories, one category of patients don't mind wearing glasses. Second category of patients is, if possible, they would like to avoid glasses. So you need to decide in which category you fit in. So once a patient has decided that he would like to avoid wearing glasses after the cataract surgery, they can be considered for the special type of lenses called as multifocal IOLs. Before going ahead with these lenses, another important question that the patient has to answer is how important it is for the patient to have absolutely crystal clear quality of vision. If that is the most important criteria, then he will not be a good candidate for multifocal IOL. But some patients who will be able to tolerate minor side effects like halos, glare, and a slight reduction in the quality of vision, they can be considered for multifocal because for them the convenience of not wearing glasses provides a slight compromise in vision and a mild side effects is acceptable. And for the people who are not able to tolerate these side effects, it's best to go in for a standard monofocal lens, which we'll discuss. Multifocals are further subdivided into bifocals, trifocals, or EDOF lenses. Patients can choose depending on their lifestyle. For example, if someone does mainly a lot of reading, bifocal is suitable for that patient. If someone is into a lot of reading, computer work, mobile, then a trifocal or EDOF lens is good for them. Now let us come to a group which does not mind wearing glasses after the cataract surgery. Now this is the most common group. Almost 99% of the patients opt for this option. And for these patients, monofocal IOL is the lens that we use. Now in monofocal IOL there are two more subtypes. In one type, which is called a standard monofocal, patients will need to wear glasses for both distance and for near vision. Whereas in the other type, which is called a toric IOL, they will need glasses mainly for near, and for distance they will be able to see without glass or with a very small correction. Standard monofocal IOLs are further divided into spherical IOL and aspherical IOL. Aspherical IOL gives a slight better low light vision, so that is useful in patients who do a lot of outdoor activities and especially for patients who do a lot of driving at night. What is the difference between aspheric IOL and a spherical IOL? To understand this, we should remember the structure called as pupil. This is the round structure seen in the eye. Its diameter changes based on the surrounding light. So in very good light conditions like daytime, or in room with good illumination, or in the evenings when you are going outdoors with very good lighting conditions, the pupil size is about 2 to 3 millimeters only. Now if the size is small, rays of the light enter through the central part of the IOL, and these rays converge to a point focus, hence the vision clarity is good. In pitch dark conditions, pupil size increases to 5 to 6 millimeters. As a result of this, rays enter from the periphery of the IOL also. In a spherical IOL, because the curvature of the front surface is uniform, peripheral rays of light bend more as they hit the surface at an angulation. Thus, these rays of light converge more, and hence a point focus is not formed, and patients get a slight blurred image. An aspheric lens or IOL is different in the way the anterior curvature of the IOL is made. Here, the peripheral part of the IOL is less curved compared to the center, so the peripheral rays bend less and point focus is obtained. So also an a good image clarity. To summarize, there are two broad categories of IOL, monofocals and multifocal IOLs, and have further subcategories with many models in them. Each have their own advantages and disadvantages. As your treating surgeon, I will tell you what lens you are eligible for, and then you can take a decision based on the information we discussed. Thank you.